An aortic aneurysm is a weakening of a main blood vessel from the heart. If the aneurysm ruptures, this is a life-threatening emergency. There are innovative, minimally invasive procedures to treat aneurysms before they become critical. Vascular surgeon Dr. Chris Marrocco gives us an overview of aneurysm disease and its treatments.
Aneurysmal disease in general is a dilatation of the artery or a dilation of the artery, like leaving your garden hose out in the sun and it expands. What you worry about is when it expands to a certain size and we don't know what that size is specifically, then it can rupture. And when it ruptures, you basically bleed out. So this is a disease where you generally don't have symptoms before it ruptures. There are some symptoms that you may get in a pre-rupture state, such as abdominal pain, back pain. People can present to the emergency room with what is being looked at as possibly a heart attack, and then the aneurysm is found out, and it's a pre-sort of rupture state, and those ones we treat emergently. In general, when we find an aneurysm, we like to treat it at around 5 centimeters, 5.5 centimeters in size. So we monitor them up until they're either symptomatic or they're that sort of 5.5 range. Again, that doesn't speak to women, which in general are smaller people, which may have, you may want to treat their aneurysm earlier due to their size. Bigger people with family histories of aneurysms have a higher tendency to rupture, and people who smoke or have smoked.
Dr. Marrocco discusses how aneurysms are treated.
The two main ways that aneurysms are treated are either with an open surgery, which is the traditional way of doing it, or an endovascular approach, which means going through the arteries from little incisions, generally in the groin, sometimes in the arm, to get to the aneurysm remotely. We use wires and catheters to place stents instead of sewing the tube in. The stent is a metal structure of some kind with material on the outside, and basically this is laid inside the aneurysm and excludes the aneurysm.
If you are concerned about your risk factors, get a screening test.
If you're worried about having an aneurysm, or if you have a family history of having aneurysms, smoked in the past, you can ask for an ultrasound of the abdomen, a physical exam where you feel a pulsatile mass in the belly. Both of those are good indicators that there is an aneurysm and that further studies need to be done to sort of define where it is, if it's truly there, things like a CAT scan or an MRI.